Talk. This is our first show, and we want to thank all you people that have written in and have asked for an opportunity to be on, and we can only choose a few of you. And today we have got one of our special guests, Dr. Michael Alboro. He's been well known in the Middle Village, Queens area as one of the leading chiropractors in the area. And Michael today is going to be nice enough to come on our show, and is really special. He's invited us to his office. And I know he's very busy today, so we're going to try to slip him in for a few minutes. And one of the leading things on the questions that we've been getting are a lot of people have been saying that, look, I got health problems, and what kind of solutions are there? I can't handle taking these drugs or the surgery all the time. And so Michael's been nice enough to going to speak tonight, or this afternoon, wherever you're watching the show, on the non-surgical and non-drug solutions to your problems. And let me find out if he's finished with his patient. Michael, you got a minute?
Yes, I do.
Oh, this is Michael Alboro, a famous doctor in Queens. Dr. Alboro, can you tell us, some of us have these health concerns, and we either afraid of surgery, we don't want surgery, and all the doctors say is, here, you got to take this medicine, take pills. If it doesn't get better, then we got to put you under the knife. Now, we've heard you at many lectures have a little bit alternative way of handling things, and we'd love for you to share a few minutes on that issue. You think you have a few minutes between patients?
Sure, yes I do.
Okay. Here's my producer, Arthur, and he's going to let you come on camera.
Okay, Arthur, thanks.
Thank you, doctor. Now, what do you think of everyone that goes to the doctor says, I got an ache here, I got back trouble here, spine trouble, shoulders here, and they say, let me see, take this medicine for 2 weeks. If it clears up, fine. If it maintains, it still hurts, let me see if we can do some kind of either acupuncture, put you under surgical, do an incision, do major surgery. Is there any alternative to that?
Sure, absolutely. First of all, if you're going to give it 2 weeks with the drug, why not give it 2 weeks without the drug? And just see how you do. That would be my first thing. Just let the body is what does the healing. The power in the body does the healing. Not drugs, not surgery. Really, no treatment or therapy does healing. Just the power in the body does the healing. So that would be the first thing. So try it without the drugs, and you don't have the side effects from taking drugs. So that's how I would handle that first one.
Okay, now, there's one topic. Do you do anything, when your people come to you, and we don't want to get too personal on any patient's history here, someone comes to you and their spine is aching, they have steady backache when they're walking, it's in pain. Just can you give us briefly what you would start out doing?
Sure. Let's take a look at this chart over here.
Are you going to share this with our viewers?
Yeah.
Okay, can I hold it?
Yeah.
Oh, what a nice guy, huh? I can hold the chart? Who's that beautiful person there? Okay, doctor, this is labeled for people that can't see out there or on the radio, new network on radio that's coming up. The spine and the nervous system. Can you
exactly
briefly tell us what's going on here?
Well, all the functions in the body are controlled by the brain.
Right.
The brain sends messages down the spinal cord just like a river, out the nerves to every single organ of the body. That's why the Creator put this system in solid bones to protect it. Sometimes because of stress and trauma, car accidents, falls, and sports injuries, the bones in the spine can shift out of place. And now the brain messages that are trying to get through to the body, let's say to the stomach, they can't get through because there's a kink in the hose.
Okay, so
the nerve is blocked. So now you start having upset stomachs or gas or bloating, and because your stomach's not functioning right. So instead of taking a pill, why don't we take a look at your spine, see if your spine's out of place, take the pressure off the nerve, and the power that made the body can go in there and heal that body. So that's really how a natural solution will work. It's about getting rid of interference.
All right, in other words, someone came to you, they got pain here, there. Your first move would not be to write up a prescription?
Absolutely not.
Wow.
We want to find out what's causing the problem. People don't get aches and pains because they have an aspirin deficiency or a Tylenol deficiency. They have aches and pains because their body's not functioning. So I look at the master system of the body, which is your nervous system. So we look there first. It's like an electrician. If the lights go out in your house, you're not going to go and change all the bulbs. You're going to go right to the panel and you're going to say, hey, did I blow any circuits? Did I blow any fuses? Let me check and see how that's doing first before we start looking to change all the lights.
That seems very, very unusual, because most people that have written to us say they go to the doctor, they have an ache, the doctor does a quick look, where's the ache, and he writes a prescription.
Absolutely. Traditional medical doctors are not really trained in touching people. If you notice that, they don't really touch you. They don't know how to touch and test the spine like I do, and the only thing they really do is prescribe drugs, because that's what they're trained to do. So I don't do that. I look at the cause by looking at your spine, seeing about getting it in alignment, and then the power in the body can go to work and do the healing.
Now, these are some follow-up questions. I hope you don't mind them. You know, we don't, we just shoot from the hip over here.
Okay.
All right. Now, if someone comes to you and says they got this pain in their right shoulder, and it's been aching for a month. They didn't want to come to you. They figured it would go away, and you do the makeover, the check over here.
All right.
And how long would it take if you go through the system to know if your way is if you can help them?
Well, I would do a thorough history. Shoulder problems could be serious problems. You know, a lot of internal organs refer pain to the shoulder, so we'd have to rule that out. Make sure it's not coming from the heart or the gallbladder or another internal organ. And once we've done that, then we can check your spine and see if it's a spinal-related problem. Many shoulder problems actually come from the neck. People aren't aware that the nerves that come out of the neck go into the shoulder and cause a lot of problems.
Now, have you studied this extensively? Because we bring you on here, we want to make sure you're one of the top experts in this field. Have you have a background in this?
Absolutely. Well, I've been practicing for 10 years, and I've been studying natural health for 20 years. When I was a young child, my mom died of breast cancer when I was 14 years old. And I watched her go through the chemotherapy and radiation treatment, and at 15 she passed away. So since that time I've been studying different solutions, natural solutions, and there are a lot out there. If you start to look for them, you'll see they're out there.
Now, later on, if you allow us, we're going to, we heard this, I don't know if it's rumors or not, that you have a special DVD.
Yes, I do. We have a special program. Many times when the spine is out of place, the discs get herniated in the spine, and you hear a lot of talk about herniated discs and surgery and sciatica and all these different conditions that come from. What it really is coming from is a spine that's out of alignment with gravity, and the herniated disc is a symptom of that. But we have a non-surgical solution to those problems that don't require surgery. It's spinal decompression that works very well with disc problems, but more importantly, we can actually use the decompression to help get the spine in its proper position so the body can heal itself and function normally.
So in other words, you give every shot for the body to heal itself.
Right. First.
That's
have
the first.
To do that first.
So you feel, is that a general thing, or that's special by you, or is?
Well, I think that's good, just logic. You know, it's not always practiced that way. You know, medicine is great in emergency situations and trauma situations. I wouldn't want to be without it. You know, God forbid you're in an emergency, you're in a car accident, the place you need to be is in the hospital. But on a day-to-day basis, how do you take care of your body? You don't take care of it by giving it drugs. Drugs make your body sick.
Right. Now, as you know, Dr. Alboro, that we here have taken it upon ourselves, me and my producer, to bring the people education and information.
Right.
And this is the first show we've done, and it was very nice of you to invite us to your office.
Thanks for coming.
And in the future, people are going to be contacting us, you know, how we found you, you know, what are you about, and everything else. And we're going to probably ask you if we're going to have permission to use your website, because we can't answer. People are going to want questions, and they're going to also, they might want future shows. I don't know if we can keep bothering you.
Yeah,
you know,
okay.
For the future. I know you're very busy, and you took your lunch hour today to give us a break here.
Right.
You think we can work something out where the people can get your website, they'll get the DVD, and they can contact you, or you're going to be too inundated with, you know, the hundreds of phone calls, etc.?
What we'll do is, the word doctor means teacher, so a big part of what I do in my office is education. So we do a lot of free workshops for our patients on all different topics: nutrition, health, fibromyalgia, carpal tunnel syndrome, and natural solutions to these problems. So I've created a DVD which I can share with your viewers. Anyone who calls the number.
Well, how much are you going to charge them? Some of our people are not that wealthy.